The Affordable Care Act may survive next year, but North Georgia patients who depend on it are now learning there's a catch.
Starting in July, the health insurance provider Blue Cross Blue Shield of Georgia will stop covering emergency room visits it deems unnecessary. Channel 3's Kate Smith is live in the studio to explain what it means for you.
Greg, the insurance provider sent letters explaining the new policy to patients. It says if patients with individual policies go to the ER and it's not an emergency, they will be stuck footing the bill.
Well, everyone's definition of an emergency is totally different.
Blue Cross Blue Shield of Georgia customers have a lot to say about a new policy meant to lower the number of ER visits.
They'll try and get you. The hospitals will try and get you for just a little pill that's aspirin. They'll try and get you for it.
The company is steering patients who do not need emergency care to their personal physicians or urgent care clinics. They don't want people to use the emergency room as their primary health care.
They're supposed to accept any kind of patient, whether it's minor, whether it's major, or a child being born, they're supposed to accept it.
There are some exceptions to the new policy. It won't apply to kids under 13 years old. Members who don't have an urgent care clinic within 15 miles of their address, or visits on Sundays and major holidays.
If a baby's sick, it's an emergency to a young mother, whereas my son's rodeo and stuff, and he hits hard, it might not be an emergency to me.
A spokesperson with the company says patients should use their best judgment. But some people are worried patients who belong in the ER may not go.
I think it's crazy because, I mean, if you get a cut about that long and they're saying it's not an emergency and they expect you to pay for it, I think it's stupid.
The company says it was forced to take action because of the rising cost of health care. But North Georgia residents say the restrictions are one more challenge in affording health care.
And it's not fair, and the way insurance is today, it's hard for most people to afford with what they make.
I checked with Blue Cross Blue Shield of Tennessee. A spokesperson here in Chattanooga says no one with Blue Cross Blue Shield of Tennessee coverage will be impacted by this change. For now, I'm live in the studio. Kate Smith, Channel 3 Eyewitness News.